Hello, my name is Neil Baum. I'm a urologist in New Orleans, Louisiana, and I want to talk with you about the importance of compliance for our patients regarding their medications. There are 125,000 deaths a year because of lack of compliance. So you imagine there are 25,000 deaths from prostate cancer. There are 50,000 deaths from automobile accidents and 40,000 deaths from opioid overdose. More deaths happen as a result of poor compliance than all of those combined. I'd like to reveal a true story that happened to me in my practice about 30 years ago. I prescribed ciprofloxacin for a patient with prostatitis. I planned to see the patient in 2 weeks, but got a call that the patient was in the intensive care unit. I thought the patient probably needed a catheter, but I went to the intensive care unit. The patient was intubated, had a catheter in place, and I wondered what was the purpose of the consult. And then I found out from the referring doctor that the patient was on theophylline, and theophylline significantly increases the blood level when taken with ciprofloxacin, resulting the possibility of severe respiratory problems. This called to me my attention that the problem of adherence is a very significant one. Fortunately, this patient did survive, but I learned a very valuable lesson about drug-drug interaction. In the next few minutes, I will cover the importance of medication compliance, suggestions for improving compliance, and give you some examples of what the future of compliance will be, and hopefully reduce those 125,000 deaths that are happening every year. Americans are over-medicated. We have a polypharmacy attitude regarding treatment of disease in the United States. Reasons for non-compliance include the patient forgetting to take the medication and also the cost of medication. What I am suggesting is that in order to improve compliance is we deep six that amber vial when patients come with a shopping bag full of all of those medications. And I'd like to give you some simple suggestions that can be done in your practice. I'd like to recommend giving the patient a wallet card that they can list all of their medications and who prescribed it and the frequency of which they take the medication. This is put into their wallet, and whenever they go to any physician, they show their medications to help reduce drug-drug interactions. The solutions can sometimes be very simple. An example would be the pill box. This is something I use, and in order to remember when I took my medications are placed into the pill box, filled once a week. Very cost-effective first step in solving the drug adherence problem. So what's the urologist's responsibility regarding the adherence problem? We can have our staff ask two simple questions when they take the patient into the exam room. How are you doing with your medications? And secondly, have you occasionally missed taking your medications? This can alert the physician the problems of cost and the problems of poor compliance. I also believe that we have the responsibility to give patient education materials and answers to the frequently most asked questions that our patients have regarding their medications. As urologists, we only use 10 to 15 drugs 90% of the time. We can provide good educational material to our patients. The package insert doesn't count. The writing is far too small for middle-aged and baby boomers to read, and no patient ever reads the package insert. It is really instructions for the doctor and not for patients. What I have done is gone to the internet and taken the commonly used drugs in my practice and obtained the frequently asked questions from the internet and provided that to the patients with their prescription and with their sample medication. Again, this can be something done by the staff and doesn't require physician time. I also think it's important to recognize that the cost of medication is one of the issues that are impacting adherence. We can give patients cost information in the surrounding zip codes, and they can save anywhere from 1/3 to 50% if we give them the information that they need to buy the medications where it is most cost efficient. I also think that we need to recognize that we can use other professionals to help with adherence and patient compliance. One of those examples is the pharmacist. The pharmacist can be a part of your team. It doesn't require any additional time on your part. It doesn't require any additional expense, but the pharmacist can give verbal instructions to the patients and can do a once a year review of the patient's medications, and you will see that 2/3 of patients who put have the pharmacist on the team had improved adherence to their medication and have improved outcomes. Again, no extra expense to the doctor, appreciated by patients, and the pharmacists get paid for it. Amazon is getting into healthcare, and they are providing pill packs for patients that give the medications at discounts, and they will have automatic refills, and the patient gets a pill pack for every day so they know what medications to take and will tell them what time they are supposed to take their medication. Pill pack is easy to get started. You get involved with Amazon and give them the list of medications, the name of the doctor, your insurance, the patient's insurance information, payment method, and the patient will receive a month or 3 months supply of their pills and what time of day they are to take their medication. Also, I think the pharmaceutical industry is trying to guide us to brand name drugs. I think there are good generic drugs that are safe, effective, and have the same active ingredients, and we don't have to go to third-tier drugs to help our patients initially. We can make more use of generic medications. We can help patients with the cost of medication. RxAssist.com has a simple approval process that doesn't require a W-9 form, doesn't require the patient's tax return, and gives them medications at free or simply reduced cost. They complete the paperwork. It is easy for seniors and baby boomers to do. They communicate with the pharmacist and the pharmaceutical company that the paperwork has been received. And the beauty is that the patients receive the medication without delays, and there are no gaps in patient taking their medication. There is smart pharmacy vials that have a timer on the cap that will tell the patients when they are to take their medication. And this again helps improve adherence and compliance. Of course, there's now an app for that. MediSafe has a free app that will remind patients of when to take their medication, and will give them an alarm at the time of day that they are to take their medication. Also, now Alexa and Google Home is getting into healthcare, and they will book appointments for the patient, give them daily reminders to take their medication, and also inform them when it's time to request a refill. Alexa can be asked when they are to take their medication or if they took their medication, and Alexa and smart technology is able to perform this function. You are going to see in the future that there's going to be combinations of medications. In urology, we already have this. J-Lin provides an alpha blocker and Proscar together. Now there are going to be one pill that combines multiple medications for the patient, so they don't have to take multiple drugs multiple times a day. Certainly one dose does not fit all. The same medication dosage for a 120-pound man versus a 300-pound man is certainly going to be different. Now there are sensors that patients can wear that will monitor their heart rate, their respiratory rate, their amount of exercise, even blood glucose levels, and will help the patient decide what medications to be taken between appointments. Now this is going to be truly personalized medication that will make the pill and the medications unique to each and every patient. What is coming down the line shortly will be 3D printing of their medications, where the sensors will tell the printer what medications and make the adjustments and give the patients a single pill that they can take once a day. The take-home message on personalized medications is that dosing will be based on each patient's data, and as a result, it will improve compliance and hopefully improve outcomes. Another option that is soon to be available is virtual care. I went to the American Telemedicine Association, and they were showcasing Addison Care, and I'd like to introduce you to Addison and how Addison may be involved in helping improve compliance for your patients. Addison can be placed into the bedroom. It's a monitor placed into the bedroom, the bathroom, the kitchen, living room, can be placed in all four or wherever the patient decides to put it. And Addison can perform examinations. It can monitor vital signs. It can help the patient with coaching regarding their rehab. It can do exercises and memory stimulation. It can be an emergency response system, and it can enhance medication management. So let's see what Addison looks like in action.
Hello there. Are you ready to take your medication?
Yes.
Allow me a moment while I pull up your medication.
Okay.
All right, you are currently scheduled to take Lipitor, Advil, and Entacapone. Great. You've taken your medication 12 days in a row. We will use the Bluetooth oximeter from your Electronic Caregiver Pro health system. Here is a quick diagram to assist you. I'm checking for the results from your oximeter reading. Here are the results. Your reading shows an abnormal heart rate. Would you like me to walk you through your plan of care?
Yes.
Here is a breathing exercise you could try to relax.
Hello, Addison.
Good morning. Welcome to the Electronic Caregiver. Hello, Rick Provencio. Nice to see you. I'm Addison, your virtual host. I've noticed you are not currently clocked in. Would you like me to clock you in now?
Yes.
Great. You are now clocked in.
Thank you, Addison.
So what will Addison do? Addison will, using the monitor placed in the patient's bedroom or kitchen or living room, will recognize when the patient enters the room. Addison will ask about the medication, and Addison will offer medication reminders if the patient forgets to take the medication or does not take the medication. Addison will contact the family or the provider, letting them know that there has been a gap in adherence. If that doesn't work, there's always another new solution to a new pill to solve the compliance problem. It's called fuck it all. And that may be the next era of solution to adherence. I take 1,000 milligrams a day, and I really believe it has helped improve my adherence as well as lower my overall anxiety level. So what's the conclusion regarding adherence and compliance? Medications for our patients do not work unless they are used properly. Non-compliance causes disease progression and increases morbidity and even mortality to the tune of 125,000 deaths a year. I believe as urologists, we have a responsibility to educate our patients and to make use of some of the technologies to reduce non-compliance. Final bottom line, compliance is a big deal, and we are all responsible to improve compliance. And as urologists, we have a responsibility, and we truly can make it happen.